Monday, Governor Baker announced hospitals in the Bay State may cancel elective procedures starting Friday due to the uptick in COVID-19. And while the aim of this is to help hospitals, there will also be financial consequences.
That's why Western Mass News reporter Sabrina Riley is getting answers for us on what these changes will mean for local hospitals.
This action will free up both necessary staffing and beds.
After a 44% increase in hospitalizations due to COVID-19, Governor Charlie Baker taking action on Monday, placing limits on elective surgeries and procedures until further notice.
This does not apply to the cancellation or delay of life-sustaining care or care that would adversely impact a patient's health.
But as far as what is deemed essential or life-saving and how this will impact your next surgery, Western Mass News reached out to Mercy Medical Center Chief Medical Officer Dr. Robert Roos for the answers.
There have been no blanket orders to suspend specific types of procedures or surgeries at this particular time. At this time, we are planning on continuing to maintain, surgeries, studies, tests, and procedures. And we will continue to evaluate our capacity and the need to shift from that based on the Department of Public Health's guidance or changes.
Dr. Roos says that they will continue to follow guidelines from the state. However, they will be very mindful not to delay both essential and preventative care based off lessons learned in the first wave.
We learned a lot from that first surge. Unfortunately, we learned that when we delay care, sometimes unnecessarily, and sometimes, if there were good reasons to, that it can create significant health consequences. This time in this surge, we want to be very mindful not to delay care unnecessarily because people do need emergency care. People do need procedural care. People do need follow-up.
And in addition to consequences that come with delaying care for patients, there's also financial consequences for the hospital.
Hospitals and healthcare systems are unable to provide the care that ultimately generates revenue, that can have a significant impact. And across the country, hospitals have been forced to close or significantly change the landscape or the array of services that they provide, which can impact care not only now but in the future. That is not a situation that we want to get into. If it did return to a point like it did in the first wave, where massive numbers of services were stopped or curtailed or delayed, that would have a significant impact, not only on the finances of the hospital, but on the availability of care for people in the community that need it.
For Western Mass News, I'm Sabrina Riley.